A kidney stone can begin quietly. Sometimes the first clues are easy to mistake for an ordinary urinary problem, but certain changes may deserve attention. Kidney stones are hard deposits that can form when certain substances in urine become concentrated enough to crystallize. Small stones may sometimes pass without causing major symptoms, while larger stones can become painful if they move into the urinary tract. So what are the warning signs worth knowing? One of the better-known symptoms of a kidney stone is pain in the side or back, often below the ribs. The pain can sometimes come in waves, becoming intense and then easing before returning again. The location and intensity can vary, so this type of pain isn't specific to kidney stones. Other conditions can cause similar discomfort. As a stone moves from the kidney into the ureter, the discomfort may shift from the back or side toward the lower abdomen or groin. That changing location can happen because the urinary tract itself changes as the stone travels. But pain that moves through the abdomen or groin can have many possible causes, so it shouldn't be used by itself to identify a kidney stone. Another urinary change that can occur when a stone is moving through the urinary tract is pain or burning during urination. But burning during urination isn't unique to kidney stones. A urinary tract infection and other urinary conditions can cause similar symptoms. So if painful urination is persistent, severe, or accompanied by other symptoms, it's worth discussing with a healthcare professional. But there's another change in your urine that can sometimes appear when a stone is irritating the urinary tract. Another possible sign is blood in the urine, which can make urine look pink, red, or brown, or the blood may only be detectable with a urine test. A kidney stone can irritate the lining of the urinary tract as it moves, which may contribute to bleeding. But blood in the urine has many possible causes, so it shouldn't automatically be attributed to a kidney stone. If you can actually see blood in your urine, it's important to have it medically evaluated rather than assuming you know the cause. And sometimes, the biggest clue isn't pain at all. It can be a change in how often you need to urinate. Some people with a kidney stone may notice a stronger urge to urinate or need to urinate more often, especially when a stone is closer to the bladder. This can happen because the lower urinary tract may become irritated as the stone moves closer to the bladder. But frequent urination has many possible causes, including urinary infections, certain medications, high blood sugar, and simply drinking more fluids. So a change in urination frequency is a clue, not a diagnosis. But there's one symptom that can become much more urgent when a kidney stone blocks the urinary tract. A kidney stone can sometimes cause nausea or vomiting, especially when the pain becomes severe. This can happen because severe pain and irritation from a stone can affect the body's normal nausea response. But vomiting can also happen with many other illnesses, so it doesn't point specifically to a kidney stone. If severe pain is accompanied by repeated vomiting and you're unable to keep fluids down, seek medical advice promptly. And now we come to a warning sign that can be especially important when a stone blocks urine flow. Fever or chills are not typical of every kidney stone, but when they occur with urinary symptoms, they can be a warning sign of an infection. A blocked urinary tract combined with infection can become serious and needs prompt medical evaluation. If you have fever or chills along with significant urinary pain, difficulty passing urine, or other concerning symptoms, don't wait to see whether it simply goes away. This is one situation where a kidney stone may need urgent medical attention, especially if infection is suspected. So, if you remember only one thing from this video, remember this. Kidney stone symptoms can vary, and some warning signs deserve much more attention than others. Kidney stones can cause symptoms such as flank or back pain, pain that moves toward the abdomen or groin, painful urination, blood in the urine, urinary urgency, nausea, and sometimes vomiting. Symptoms alone can't confirm that you have a kidney stone because several other conditions can cause similar problems. The biggest warning signs are severe or persistent pain, visible blood in the urine, difficulty passing urine, or fever and chills with urinary symptoms. Those symptoms deserve medical attention, particularly when they appear together. But there's one important question left. What should you actually do if you think you might have a kidney stone? If you develop symptoms that make you think you could have a kidney stone, don't try to confirm it from symptoms alone. A healthcare professional may use your symptoms, medical history, urine testing, blood tests, and sometimes imaging to determine what's happening. If you're having severe pain, fever, or chills, repeated vomiting, or difficulty passing urine, seek medical attention promptly. These symptoms can sometimes indicate a complication that needs urgent treatment. The good news is that many kidney stones can be managed successfully, but the right approach depends on the stone and the person. The treatment for a kidney stone depends on factors such as its size, location, symptoms, and whether it's blocking urine flow. Some smaller stones may pass naturally, while others may require medication, a procedure, or another treatment chosen by a healthcare professional. Trying to force a suspected stone to pass without knowing what's happening can be risky, especially if you're having severe symptoms. The safest approach is to have concerning symptoms assessed and follow the treatment plan recommended for your situation. So before we finish, let's bring the 7 warning signs together and separate the symptoms that may be uncomfortable from the ones that may need urgent attention. So, the 7 possible warning signs we've covered are flank or back pain, pain that moves downward, painful urination, blood in the urine, urinary urgency or frequency, nausea or vomiting, and fever or chills. But remember, having one or more of these symptoms doesn't prove that you have a kidney stone. What matters most is the pattern of symptoms, how severe they are, and whether warning signs such as fever, chills, difficulty passing urine, or severe persistent pain are present. If those symptoms occur, especially together, it's better to seek medical advice promptly rather than waiting for them to become worse. And there is one final thing worth remembering. Knowing the warning signs can help you recognize when it's time to get checked. If you experience symptoms that concern you, especially severe pain, fever, or chills, repeated vomiting, or difficulty passing urine, contact a healthcare professional promptly. For more simple, evidence-aware kidney health videos, subscribe to VitalBites. This video is for educational purposes only and is not intended to diagnose or treat any medical condition. If you have symptoms that concern you, please speak with a qualified healthcare professional.